Hi, and welcome to the Vet Dental Show. I'm Brett Beckman, board certified veterinary dentist, and we do this podcast every Wednesday for you, the technicians and veterinarians in general practice, to give you insights and actionable steps that make your dentistry service even better. If you have not already, the International Veterinary Dentistry Institute is sponsoring a live seminar, online training, July 17th, and you're invited. Register at ivdi.org/July, and we'll see you there. I'm honored today to have a friend, a great friend, and a colleague, and a great colleague, and a co-worker and great co-worker with me, Dr. Jodi Reed. And
hey.
Jodi is one of my favorite people. She's one of the students that have been with me longer than anything, and I don't really consider her a student. I haven't for a long time. We're now students together. If nothing else, she teaches me. So we're so happy to have her. And Jodi, if you wouldn't mind, just give the audience a little bit of information on your backstory.
Yeah, absolutely. So I am a general practitioner, and I graduated in 2001 from UF, and I was out in general practice, and I loved general practice. I toyed with the idea of going and actually doing a residency in soft tissue surgery, small animal surgery. And I just loved being a GP so much that I just ended up staying there, especially because I could still get to do surgery. And like everybody, I hated dentistry because I didn't have the right tools. And that's when I found you, and I was an associate working for another practice, several different practices over the years, and amazing techniques and being able to do dentistry to the highest quality. I fell in love with that because I'm, a surgeon at heart, and I was working at a practice and unexpectedly had lost my job, and it was probably one of the most devastating and emotional times in my life. And when I went through that, I opened my own practice with a very dental heavy focus, and continue to do all of your continuing education as well as with other board certified dentists and the forums, and really built up my practice to now. I am so honored to get to work by your side in Atlanta and teaching, and I'm still a general practitioner in North Carolina, but I get to do all sorts of fun dentistry stuff with you. So that's me in a nutshell.
Excellent. Well, I couldn't be happier to have you. And Dr. Jodi was also the very first veterinary dental practitioner and has a separate practice here in my general practice. In addition to helping me, she has a separate practice here in my practice that is her as a veterinary dental practitioner, and also 3 other VDPs with her. Can you tell the audience a little bit about that?
Yeah, absolutely. So Brett and I are here, and I do support him with the specialty practice that he has here, but we're really only in this practice 3 days a month, and trying to figure out, Brett bought a beautiful new building, and it's this gorgeous dental suite. It's amazing. And so we decided to start that practice and to be able to open up the building to use it more efficiently and do it every day. And I had the idea that since we're doing this veterinary dental practitioner program, or the VDP program, it's a certification for general practitioners. Since we are doing that together, and I'm involved with a lot of that we decided to open up a practice here that does general dentistry, and it's only run by veterinary dental practitioners, so that we know that the vets that work here are absolutely the highest possible caliber of veterinarians in general practice with regards to general dentistry. And so that's where Atlanta came to be, and that's where we became partners there. As far as the veterinary dental practitioner program. It has been such a joy and such an amazing journey for me, and as well as all the other VDPs who have gotten the certification and gone through the program, as well as the hundreds that are currently enrolled and going through the program right now. And so the VDP program just gives us a way to really expand our skills, especially with regards to extractions, to be able to have a complete group of people who love dentistry and really want to do it to the best of our ability as GPs, because we are the front line. We see the cases long before any of the board certified dentists do. And we don't claim to be board certified dentists, nor do we represent ourselves as board certified dentists. And we do definitely still refer to boarded dentists for things that we can't handle. But as general practitioners, we can handle so much more than is coming in the door, as long as we have the education and the skills and the practice to be able to do that. And the VDP program really gives us as general practitioners the ability to do that to such a high level. And then we get tested on it. So you and I, Brett, grade the students on their ability to have themselves or their technicians efficiently and effectively take full mouth series x-rays. We also do a written multiple choice test to test them on their knowledge based on the 46 hours of videos that are included with the program, including anesthesia, extractions, flaps, radiographs. Oh my gosh, there's so much. It's such an in-depth program. And then we do the actual live assessment on a cadaver, where the VDP candidate has the ability to practice the extractions and show us that they can do those to a very high level, and that they can complete that and earn that certification, and that it's a recognition for all of the hard work and all of the extra education that we've done as GPs to separate ourselves, somebody who loves dentistry and really wants to do it to the highest possible level.
Excellent. Well, can you maybe step behind the door a bit and reach back and give everybody a little bit of a taste of what the group is like themselves? What are the interactions? What have been the joyous things that you and I have talked about in the past, that we get out of everyone in that group, and we hope that they get out of us as well?
Yeah, it is such a supportive group of veterinarians, and one of my favorite parts is that it's literally vets from all over the world. And I've teased you before, and I've said it on the forum, and it's actually really not a joke. I love to travel. It's like, I want to do a worldwide tour to meet all the VDPs and veterinarians who are in your group, to be able to go to Holland and to South America, to Central America, to Canada, to all sorts of places, Germany, Ireland. There's so many vets from around the world. And we all come together in this very collaborative, very supportive group of GPs who love dentistry. And we get to do that and be able to, in a non-snarky, non-judgmental, much more of a, hey, we've all been there. We've all made these mistakes. We've all made bad decisions, or have had cases that, even though with great training, didn't go well. I mean, as a board certified dentist, you've had that. We all do. We're all in a place where we're humbled to be able to share those experiences in a really safe way, and to be able to not only learn from what happens with other people, whether the cases went amazingly well or they had troubles. And so to be able to work with veterinarians from all over the world in such a supportive way, and we do it via Facebook group pages where we go over cases. We have mastermind groups where we literally sit and talk for an hour on a Sunday morning, drinking coffee, hanging out, and presenting cases, or talking about different controversies or different things. And we even have conversations of like, how do we better ourselves as human beings, not just as veterinarians? And so for me, the friendships that I've made and the group itself is just so wonderful, and it's just been such a joy and such a huge honor and part of my life to be a part of it.
Well, I'm super proud to have you and all of the people that are in the program and all the people who have graduated from the program, and just be able to call them friends. And we actually can, because we see them all the time. We're there to support them. I personally have been on phone calls on numerous occasions with different people, not for dentistry, but for support for personal problems and other things. So it's so rewarding to me from all aspects. And I can't imagine that I wouldn't be doing this today. You know, and there was a time when it was a little bit of a question about whether I could ever get through and be able to do this and offer this training for general practitioners. And I know you've heard that there's some still ongoing controversy about that, and I just want to say there, at this point, there is no controversy. There was some a bit with getting everything started, and that's kind of filtered over into the present day, I guess, because of social media and all. And I'm not really one that goes on social media, so I'm not really aware of it. But you brought me to the point of awareness of maybe some spillover over that, and I don't know if you want to say anything about that, or
yeah, I'd love to. So some of the controversy that comes up is that, you know, the VDP program is not a recognized program. It's not a specialty program, and I've heard the term that it's something that was made up. And, you know, to be fair and honest, I wouldn't call it made up. I would call it created. Like every other certification out there, it was created in order to really help a subset of people, of veterinarians who want more, who want the recognition and want the education and want to know that they're doing dentistry to the highest possible level. And if you think about it, you know, there's a pain management certification, there's an acupuncture certification, there's a fear-free certification. So there's lots of certifications that are out there and available, and they were all created at some point somewhere, just like the VDP program has been created, in order to really create this army of general practitioners who are doing really high level general practice. We're not teaching root canals. We're not teaching major malocclusions and major fracture repairs and things like that. We're teaching the things in the VDP program that us as GPs should absolutely be doing. And right now there's not that many board certified dentists, and they can't take care of every pet that's out there, and they shouldn't be having to take care of the periodontal disease and the extractions and the things that us as first-line veterinarians should be handling. And I hear so many GPs say they can't get them into their patients when they really need to go see a board-certified dentist. They can't get them in for 6, 8, 10 months. And if we could pull back and really handle the things that we should be handling as GPs and handling it to a very high level and a very high caliber, the boarded dentist could be there to do the things that they really should be doing for our patients. And so for me, there really isn't a controversy as to the VDP program. I never represent myself as a specialist. I never let clients believe that I am boarded or that I do things that boarded dentists do. I don't represent myself, and nor does anybody in the VDP program, and nor do we encourage that. So really, it is a way for general practitioners to separate themselves from the masses and going, I have taken a very strong special interest in dentistry, and I want to do it to a high level. And I've been evaluated by a board certified dentist to say, hey, I can do extractions to a great level. I've been through a program and got myself educated to do this to a really high level, because as most of us know, we just don't get that type of education in vet school. It's sad and it's a shame, and I really wish that they would bring it into the vet schools. We wouldn't have to have such a strong VDP program if it was more widely available, but it's just not. And I am ever so grateful, and everybody that I know who's in the program or has completed the program could not be more grateful to have had the opportunity to learn so much through the program, but to also be able to have our skills, evaluated and tested to know, hey, you are doing a good job. This is going really well. And then on the back end, to have the full support in the group that you've created of other VDPs, but also people going through the program, to still have the ongoing support to go, I have cases that are still challenging, or hey, I can't get this into a board certified dentist for 8 months, 10 months. How do I manage this? How do I handle this? What do I do? And so for me, the VDP program has changed my life, and it's given me the ability to truly focus on dentistry. And that's the best part about it for so many of the VDPs who are in the program. We want to do dentistry, and we want to do it really well. So I'm grateful, and I know they are too. And for me, there's really no controversy, because you're not representing us as specialists. You're not touting us as specialists. You're just saying, hey, these are the GPs who've gone out of the way to really do this well. So I am so thankful. Thank you.
So thanks, Jodi, for that excellent synopsis of the VDP program. I think it really lets everyone kind of look in and see exactly what we do, exactly what we're all about. And I do want to bring out one point that you mentioned and make it a little bit clearer, in that this is not a program for every veterinarian. It's not something that's easy. And it also takes the passion, like Jodi exudes, for veterinary dentistry on the part of the participant. And you can certainly have a passion for anything, and in order to make it a mission in your career, that is kind of what we culminate for the individuals in the program. They know that they want to make an impact for the rest of their careers in an area in veterinary medicine. And for a lot of people, it's not dentistry. It might be something else, or it might be nothing at all. It may be that many people are content just treating and helping the animals that they currently help in a general way and in their own way. And that's absolutely amazing and wonderful. Yeah. But there are people who have passions for different parts of veterinary dentistry, and they pursue those. So this is that for dentistry, and allows the people that graduate and the people that are in the program to provide that for their patients from now until the end of their careers at the best level that they can possibly do it. And so it becomes a purpose for them in their career, where they're making a mark wherever they're at, and they're the go-to person for dentistry in their practice for sure. And they're also, and I did a little informal survey in that July 17th, which is Sunday, is our next class is coming through, and I wanted to be able to tell them what the potential is for you to get, as a VDP, actually referrals from other practices, because I know a lot of our VDPs are getting referrals from other practices. And we had an amazing response. I don't know if you saw that.
I did. I didn't respond because I knew I took referrals.
Well, we had an amazing response that just kind of blew me away about how many people that are, and some of them are just in the program. Some of them have the skills and they just haven't gotten to the assessments yet and haven't completed the program. But many of them fall into that category, but just an amazing number of people who are getting referrals from other hospitals of things that they don't feel comfortable doing. And when I say that, when Jodi's talking about the main thing that veterinary dental practitioners do, it's essentially perio and surgical extractions and doing it correctly, and obviously putting full mouth radiographs and post-op radiographs in that mix, and having a staff that can provide that through the program that does things right. And
yeah, I think it's really important to actually that point, because the VDP program is not just about the individual veterinarian. It's literally about creating a dental team within that hospital. And there's lots and lots of associates who do this, but we also have lots of practice owners who do it as well. And so this program is set up to bring your technician along, and so that you guys are doing everything that you possibly can to create efficiency, to create profit, because that's not a bad word, to create a entire dental program within your hospital, to really bring it to that level to where you are able to get referrals and you are able to get more cases in, and you're able to do them with confidence. But having an entire team on board and going through this program together is amazing. And that team can be a 2-person team. It can be a 5-person team. It's such a great way to build a dental program within a hospital so that you can really be set up for referrals. When we do the VDP, in order to get that designation, you actually have to have very specific equipment in your hospital. You've got to be able to take x-rays, and you've got to be taking x-rays on every patient, full mouth x-rays. You have to be efficient at doing it. And it's everything. It's the whole kit and caboodle. It's not just about you being able to do extractions well. It's about being able to client educate. It's about being able to, receive those referrals, to help your other general practitioners in the area or within your hospital. It's such a robust program that really does involve everything. It's not just about me being better and me being a VDP. It's taking my whole team along with me in the process. And it was so much fun. David Calderwood and his team is probably the best VDP who had the most amazing team experience going through this program together. And I'd love for you to talk to him at some point about his team experience with the VDP, because it's so cool to listen to him talk and how excited everybody was about doing it. And I'm starting to hear that from other VDPs, that when they're bringing their team along, it just adds a whole nother layer. So this program really is about raising the bar for veterinary dentistry in general practice. And I know that you weren't expecting me to ask you questions, but I think it's important for our listeners to...
Wait a minute.
No, I'm asking you a question. I know you weren't prepared for this, but I want you guys to know that I've worked side by side with Dr. Beckman for 3 years now, teaching and also working with him in the practices. And he does not do any of his education or this VDP program as a financial gain, as a personal financial gain. I can tell you, I personally know that he does this because this is his legacy. He wants us as general practitioners to have so much success and to do this well. And I would love, because you get emotional, I'm sorry I put you on the spot here, but I think it's really important for people to know, for veterinarians to know why you did this and kind of what prompted you to start a VDP program and really prompted you to start being one of the grandfathers, not that you're a grandfather, sorry, but a grandfather's in teaching. We tease each other about age all the time, but in teaching veterinary, general practitioners dentistry, because it's an emotional topic for you. And I think that they need to know this is truly a labor of love. And you have probably spent more money and time creating these programs than you'll ever reap the benefit of, but it really is a labor of love. And I would love for you to share why you do it, because it's touching, and it just, not that I didn't love you so much before, but it really just made me love you even more when I found out your why as to why you teach the way that you do and why you created this program.
Well, I appreciate that question, and I guess I will actually have to answer that and try not to get emotional.
No, you can get emotional. You're supposed to. It's okay.
What Jodi's referring to, I had been a specialist for a while, and I'd also been teaching for a while and doing courses not at the level that we are today, but certainly teaching at the major meetings, and we had our own little teaching team that would go to different cities. And so I've been doing the teaching for quite some time before this event, and I was working at a specialty hospital, and I was the dentist in that specialty hospital, and it was a very large specialty hospital, and I had an opportunity to meet a wonderful lady with a beautiful Irish setter, and unfortunately this dog had gingival hyperplasia excision about 10 days before I had seen the patient. And as many of you know, Irish setters are predisposed to gingival hyperplasia. And so it was generally a routine procedure in general practice where we do full mouth x-rays. We make sure before we take that gingival overgrowth or gum overgrowth away that we don't have periodontal disease, and we have to extract the teeth before and as a priority to doing the excision. So that being said, just as a base for those of you to get you on board with how those are approached and get everybody on the same page, this patient came in and had a procedure done by a veterinarian in the area. And as soon as I lifted the lip up, I got a response from this otherwise amazing, beautiful, very calm dog, a very significant pain response. And I was able to actually work my way to get in to lift the lip up to see what was going on. And what I saw was amazing and horrendous. And what I was looking at with that little peak, which ended up being, once we got this patient under general anesthesia to evaluate what was going on, ended up being generalized, was where the lip margin would normally be on the maxillary canine, we had a brown discoloration that was about 5 millimeters in depth, and then we had severely inflamed gingiva over the top of that. And what that ended up being was the result of a practitioner that had used an Elman electrocautery electrosurgery unit to do the excision and had it on the wrong setting. And so essentially what happened was, from a treatment standpoint, the tissue was severely overheated. Not only did the bone die, but the pulp in those teeth were literally fried, and we ended up having to do almost full mouth extractions on that patient. And one of the saddest things is the brother, who this very nice and very understanding pet parent also had the exact same thing done. And so we saw that patient as soon as we possibly could to resolve the problem for both of them. And at that point, that was so impactful for me that I made it my mission and my legacy to try everything that I could not to let that happen in general practice through education of the practitioner. And so that was the start of really ramping up our teaching effort and making the students a bit more accountable by really paying attention to what they were doing and making sure that if we saw that they were in a lab and they weren't quite at the part where we thought that they would be qualified to do even extractions in general practice, that we discourage them from doing that and encourage them to get more training, not necessarily with us, but get more training and certainly practice a lot more before they actually did live patients. So that was the initial push, and then as time went on, we recognized that a lot of the students that came to the courses were leaving there despite the fact that they didn't have adequate training or time enough for adequate training to be proficient and be good, and we're still seeing patients. And unfortunately, we still see that today. We see that every day, and we're fighting that every day. So that evolved into eventually going through the process of how can we make more impact, and it resulted in the program and holding the participant accountable to being at a level that makes them exceptional in general practice and dentistry, and that's what culminated in the Veterinary Dental Practitioner Program. So thanks for listening to this episode. We'll see you next week. And if you haven't already, please register for that free live new training July 17th. We're expecting around 600 to 1,000 people to be there live on that date. So don't miss out. IVDI/July will get you into that course. And we'll see you guys next week. Take care.